actually that closeness, that close-knit community that develops through the NIA is a really important aspect that has great impact. We hear some of the fantastic figures about some of the outputs that we've already started to deliver over a couple of years, but actually there's a lot of softer outputs about putting people together who support each other to be really brave in a very difficult environment. And a couple of reflections listening to the 11 fellows that we heard. The first is how we use technology to enable and empower the patient. The second is how we use that technology to make people be able to do their jobs better and more efficiently. And the third is how we use that technology to make the system more efficient. And actually, through all of the 11, we heard examples of all of those. And we heard some actually phenomenal figures, 99.6% patient satisfaction, 99.5% patient usability. What that represents is that people who have developed systems that have been co-designed with patients and that are being used, because unless we do things that are easy to use, that have easy interfaces, the system won't adopt them. And I think the sort of solutions that we've started to hear about, combined with how we bring patients into the centre of healthcare, how we start to impact on behavioural change, these are the things that will start to make the big difference to the system. And one of the things that we believe about is trying to create a safe space where people can try and do something different, alternative to the status quo. There's many people who will argue that the status quo has to be changed, but what people here are doing is actually coming up with real alternatives, testing those, evaluating them, sometimes failing, but actually then by that iteration coming up with what will be the new future for healthcare. And what that provides for all of us is hope, and that's what we need as much as anything.